Hey everyone, my name is Isabella and welcome to my ASMR channel. Before we get into today's video, I just wanted to mention a couple of things. First, if you're looking for any additional content, you can sign up for my Patreon, where for $3 a month, you will get access to 4 extra ASMR roleplays every single month. I also have an OnlyFans, so if that's something you might be interested in, you can find the link to that below, clicking on my Linktree link. You can also use my Linktree to find my Vizio page, which is where I make all custom videos. So if you're looking for a custom video, that is the link you will want to click on. I have an Instagram page you can also follow, and the Linktree link will also lead you to that. Last but not least, please subscribe to this channel, and now let's get into today's video. Hello, my name is Isabella. I am Dr. Reynolds' medical assistant. We met a few weeks ago. I don't know if you remember me. At the time, I was wearing a face mask, but the hospital just last week got rid of their mask policy, so might be a little confusing, but I am the same medical assistant that helped you when you had that sore throat you came in for. How is that feeling now? Amazing. Okay. Yeah, because your strep test came back negative. I think we thought it was maybe just allergies. It happens. Pollen count was so high when you came in, so we had a lot of people coming in for the same exact reason. I know, 100%. Okay, so Dr. Reynolds is finishing up with another patient right now, so I am going to get your head to toe assessment started if you are okay with that. And then at the end, Dr. Reynolds will kind of come in, just, look over everything that we did and make sure you are good to go. Perfect. Okay, so let's just take a look at your chart. Okay, nurse came in and did your temperature. That was normal. Blood pressure looks good. Weight looks good. Okay, very close to your weight from last year. How's your diet and exercise going? Okay. You have really great blood pressure. 120/60 is perfect. Honestly, tell me your secret. Okay. So I'm going to start by just looking at your head. Any lesions or deformities, just checking for that. Sorry, my hands are a little cold. So, how has life been going for you? Any fun plans for summer? Wow, that sounds really fun. Wow, I wish I knew how to surf. Absolutely no clue, but that sounds amazing. I am so jealous. Okay, I'm not feeling any bumps, not seeing any lesions. Your head feels just as good as it looks. Okay, perfect. Okay, now, seem to have misplaced my otoscope. Go figure. So I'm just gonna take a look inside your ears, your nose, back of your mouth. I'm sure everything's gonna look amazing. You look very healthy. You just come over on this side and look in your ear. That looks good. Do you find that you get a lot of earwax buildup, or no? Looks good as well. Sorry that I have to get so close. Okay. And now look up. Let me take a look up inside your nose. Okay. I see some like redness and inflammation due to residual allergies. Yeah, we kind of already determined you're having just some springtime allergies. Okay, and then open your mouth. Good. Yeah, even the back of your throat, I see some cobblestoning, which is a telltale characteristic of allergies. So you, my friend, have some seasonal allergies, and we can talk, depending on how much they bother you, about there's a nasal spray we can prescribe you, over-the-counter stuff such as Claritin. Have you ever tried anything? Gotcha. Okay. Well, something to think about. You don't have to make any decisions right now, but yeah, definitely something to think about. I'm just gonna make a note of that. Okay. Now we're just gonna do a mini neuro exam, make sure everything is good. So I'm just going to start by moving this left to right, follow it with your eyes. Good, good. Up and down. Very good. Good, perfect. Okay. Just making notes that everything is good so far, so don't get nervous. I'm not making, any notes about abnormal findings. So next I just want you to smile. Frown. You have such a nice smile. Okay, now I'm going to feel both sides of your face for any differences in temperature. Everything feels good. Do you feel any differences in sensation? Do you feel my fingers more strongly on one side of your face versus the other? No. Okay, good. That's what we want to hear. Okay. Now I'm going to rub my fingers like so on each side of your head, and you are going to let me know if you hear one side louder than the other side, okay? So we'll start here. Hear that? Okay. Good. Yes, good. Okay. Now can you lift your shoulders up for me? Stick your tongue out. Move it side to side. Good. Okay. Next, I'm going to have you close your eyes, and I have this spray here, and it is a common fragrance, so I'm just going to, if I can get the cap off, I'm just going to spray it once, and you're going to tell me what you smell, okay? I sprayed that more than once, but let me kind of waft it over to you. You can also just smell right from the lemon, yes. It's a lemon room spritz. It's very nice. Got it from Trader Joe's, actually. $1.99. Gotta love Trader Joe's prices. Okay. you wear glasses? No? Okay. And did the nurse do an eye test on you? Have you read the eye chart when you first came in? Okay, she must not have put this in your chart, but that's fine. I believe you. And she didn't say there was anything abnormal. Okay, let's just go with that then. So next, I'm going to listen to your heart and lungs. For some reason, so many patients, it's their favorite part of the exam. Oh, that's funny. Yes, okay. So funny story. A lot of people are like, oh, you must be a doctor. You're wearing a white coat. I am. I'm wearing a white coat, but not like doctor white coat, you know? It gets confusing, but honestly, no one says anything. This coat, the hospital is so cold. I mean, you probably know that. You have a sweater on. Really nice sweater, by the way. I noticed it right when you came in. Is this cashmere? Love that. It looks really good on you, too. The coloring. Yeah. No, I love a good neutral. Okay, so just breathe normal for me. Just normal breaths in and out. Good. Keep. Let's see. Okay. Now a deep breath in through your nose, and out through your mouth. In through your nose, out through your mouth. In through your nose, out through your mouth. In through your nose, out through your mouth. Okay. Everything sounded good. Strong heartbeat. Sounded a little elevated, but that's typically normal. So many patients that come in, being in the doctor's office environment, a medical environment, makes people's heart race a little bit, or I don't know. Maybe you're just nervous around me. Okay. Sometimes it's like that, especially, I get that way too when I'm having an examination done. I prefer that, I have a woman, either, medical assistant or doctor performing the exam on me, but the nurse told me she checked with you before I came in and you were completely fine having me do your physical exam. So I appreciate that, thank you, because if not, I'd be sitting in the break room not knowing what to do with myself. Dr. Reynolds is the best though, so you really are in good, capable hands, and I hope my hands will be just as capable. I do apologize, they are a little cold. Okay, so now I'm going to palpate your abdomen, and this is just checking to see if there's any tenderness or distension. So if you could just lift your shirt up for me and just lean back a little bit. You don't have to fully recline, but just like lean back in the chair. Good. I'll just palpate. Any tenderness, everything feels good. I don't feel any excessive bloating or anything of that nature, so you may put your shirt back down. Very good shape, by the way. And now I think you know what comes next. Okay, glad we got that out of the way. So next, everything was normal. Yeah, that can be the only awkward part of male-female. Okay, well, female-male. So next I want you to hold up your arms, kind of press into me. Hi. Okay, good. And now I'm just going to check your reflexes. We're going to be checking biceps, brachioradialis, triceps, knee, and Achilles. So, good. Good reflexes, strong reactions. Turn like that. Good. Okay, now your knee. Good. Everything was good. Good reflexes, strong. Now put your arms out, and I am just going to, where is my, just gonna use these two feathers right here, and I want you to keep your arms out. I'm going to tap. Do you feel the same sensation on both sides? Does one side feel stronger than the other? Okay. Tap again. Same or different? One more time. Same or different? Good. Okay, and I didn't notice any rashes or lesions on your body. Did you notice anything in the shower, or anything you've noticed that you wanted to bring to my attention? Do you have any medical concerns today, or are you feeling good? Okay, and just a quick mental health check. I did want to ask have you had any changes in mood over the last 2 weeks, little interest or pleasure in doing things that you once found pleasure in, or feeling down, depressed, or hopeless? No and no? Great. We love to hear that. And if that changes for some reason, you can always reach out to us. We are here to help, and we can set you up with any type of doctor that you think would be of assistance to you. So keep that in mind. It's important. Life can be hard, and we want to do our part to make sure that we're supporting you. But that's everything that I had to do. It looks like Dr. Reynolds hasn't knocked on the door yet, so I guess he is still busy with his other patient. I guess we'll just stay in here and chat a little bit until he is ready. So I don't think it had listed here where's your date of birth? So you are, happy almost birthday. Very exciting. Do you have any birthday plans? Fun. And let's see here, it says single. Is that still the case? That's more for like an insurance thing. Okay. And do you have a partner? No partner. Same. With these hours, super hard to actually get out there and meet someone, but I love what I do, so can't complain too much. And what do you do for work? Oh, I'm so jealous. I do love what I do, but I would love a position where I could work from home a little bit. So until I start seeing patients in the comfort of my apartment, that dream is just gonna have to sit on the sidelines for a little bit. But yeah, so birthday plans are sounding like that'll be fun, just hanging with friends. My birthday was a couple weeks ago, and it was good. I could have been a little better, if I'm being completely honest. I don't know. Being single is just so weird sometimes, like at times I love my freedom, I love doing what I want when I want, but then other times I'm like, it would be so nice to meet an attractive guy who I could share my life with and really form a, deep connection with. It's something that I know is going to happen, when you're like least expecting it to. I feel like I'm constantly just keeping my eyes peeled for the right guy. It's hard though, because since I do spend so much time at the hospital, it's like a lot of the guys I meet are patients, and that just has a whole separate set of concerns, not the most professional thing, but as long as they're not your patient, I guess it's okay. Which, for me, I mean, like, you're Dr. Reynolds' patient, so technically not mine. Sorry, I wasn't, like, saying I wanted to, go on a date with you. Not that I wouldn't. I mean, you're very attractive. Yeah, of course. I'm sure you get told that all the time. I mean, yeah. I'd like that. How about 8 p.m.? Okay. Yeah, let's go for a drink, I guess. Let me give you my number. What's your number? Okay. I will see you at 8 p.m. I really wasn't expecting this, but you asked, so who am I to say no? I was just gonna go home and watch something on Netflix, so. But don't mention this to Dr. Reynolds when he comes in. Like I said, you're not technically my patient, but there's still some judgmental facial expressions I'm sure he would be making at me throughout the day. So, yeah, it'll be our little secret. Really nice meeting you, and glad to know I'm going on a date with someone as healthy as yourself. Okay. I'm going to go track down Dr. Reynolds for you, and I will see you at 8 p.m. Very nice seeing you again. Did you remember me from a few weeks ago? Yeah, without the mask, I figured you didn't, but I recognized you. Those eyes, I wouldn't forget them. Don't feel bad. It's my job to remember things. Okay. Dr. Reynolds will be in momentarily. I'm going to go get him for you. See you later. Thank you all for watching. I'd like to take a moment to give a special shout out to